Thank you, everyone, for being here. I'm really excited to have this conversation with an incredible group of mental health leaders about how technology is making youth mental health care more accessible and effective. So, before we get started, I just want to say a huge thank you to our partner and funder, the California Department of Healthcare Services, for supporting this work at the Child Mind Institute. Their support makes discussions like this possible. And I'm just really excited to be joined by four fantastic guests today to explore how technology is shaping clinical treatment and tackling the youth mental health crisis. So, first, we have Brandon Staglin, co founder and chief advocacy and engagement officer at One Mind. Brandon has been a powerhouse in advocating for science driven early intervention for youth facing serious mental health challenges. He's also a huge believer in the power of lived experience to shape the future of mental health care. One Mind is all about advancing research and driving innovation, whether through science, supporting early career researchers, or backing mental health startups with initiatives like the One Mind Accelerator. And we're really excited to also have two companies from the One Mind Accelerator here today. So, first, we have Tracy Brubaker, Chief Operating and Chief Clinical Officer of Vita Health. It's a company at the forefront of delivering acute virtual behavioral health care with a strong focus on suicide prevention. Tracy brings over 20 years of experience in leading behavioral health organizations across the full spectrum of care, including the startup space, and she's a licensed clinical social worker. Welcome, Tracy and Brandon. And then last but definitely not least, we have Obi Felten and Dr. Kim Newell-Green, co-founders of Peers.net, a company using technology to scale professional peer support and make mental health care more accessible. Obi comes from a background in tech and innovation, having been a product and marketing leader at Google X, where she helped turn bold ideas into reality. And Kim brings nearly 2 decades of experience as a pediatrician and currently serves as an adjunct associate clinical professor of pediatrics at the University of California, San Francisco. And she was also a chief healthcare innovation officer at Kaiser Permanente, San Francisco, where she worked on bringing new solutions into clinical care. So, a long introduction, but I'm so excited to be here with all of you. Everyone brings such a unique mix of expertise to this space, and I'm really looking forward to this conversation. So, thank you so much. So, Brandon, to kick this off with you, One Mind has played a pivotal role in funding technology based interventions for mental health. How does One Mind think about the role of funding decisions in advancing mental health solutions, particularly for serious mental health illnesses? And how do you see technology shaping early intervention strategies?
Thanks for the question, Yuki, and it's a pleasure to be here. Great to be here with some other wonderful colleagues and leaders in the mental health space, and including yourself. Um, so One Mind, over the last 30 years, since my family and I founded it back in 1995, has been responsible for the influx of about $600 million of funding into the mental health sphere to develop better solutions for people in need, from discovery through development through delivery of new services and solutions. About a third of this has come from directly fundraising, and about two-thirds has come from follow-on grants from the government agencies that also support these things. So a key part of our model in funding is we call it venture philanthropy. What this means is that we aim to unlock additional funding from additional sources to accelerate the research and innovation that we start to support based on the merit that it generates from and the ideas it generates and discoveries from the funding we initially give it. We also provide, beyond the funding, community and mentorship for the beneficiaries of our funding to grow their careers and the success of their enterprises and their institutions. So that this secret sauce enables us to really make a huge impact. So, for example, over the last 20 years, we funded 48 early career scientists through our Rising Star Awards program, focused on developing new treatments for severe mental illness. Great example of a scientist who's excelled in this category is Dr. Suzanne Amari, who has, since being one of our rising stars in 2019, gone on to lead the Welcome Leap and multi-channel psych initiative, which has developed a new way to diagnose depression more precisely than has ever been possible before, and give somebody who's suffering the exact most beneficial treatment right from the get-go as soon as they're diagnosed. It's immensely huge advance. Another example is our One Mind Accelerator. And we have Tracy, Kim, and Obi, who've been members of our One Mind Accelerator cohorts over the last 2 years. We provided $2.1 million in funding collectively to 21 companies over the last 2 years. And they've gone on to raise an additional $180 million collectively in part from the support we've given them. And because we offer them not only the funding, but also more importantly, a vast community in the mental health sphere, including mentors who can help them develop their businesses, coming from the perspective of insurance companies or health systems, or even people with lived experience through our Lived Experience Council, which I'll talk about later. We've been able to help them grow their businesses successfully, which you'll hear about soon, as well as make an impact on human lives. So these startups have influenced about 500,000 lives over the last 2 years, which I'm really excited about that they've been able to do. And then to your next question about how does technology impact youth mental health? So we see this as a very important factor. From the very beginning of One Mind in 1995, we've been funding and supporting the development of tech-based solutions for youth mental health, including one that I benefited from myself when I was a young man, developed recovering from schizophrenia, a thing called cognitive training. Today, we support One Mind Accelerator companies to really carry the tech forward, and we curate them very carefully from many, many applicants. So we choose the best technologies to support and the best companies that are driving them forward to help people with mental health challenges everywhere, including young people. So really excited to hear from Tracy, Kim, and Obi about what they're doing in these areas. Thank you.
Thank you so much, Brandon. And it's so grateful that there's organizations like One Mind providing this sort of like holistic approach to funding, building communities, bringing these leaders together. So thank you so much for everything that you guys do. So kind of switching gears, I would love to learn a little bit more about sort of the why behind building Peers.net and Vita Health. So starting with you, Obi, what gaps in youth mental health care drove you to create Peers.net?
So I'm a technologist, but my journey with mental health started over 20 years ago when my husband was diagnosed with bipolar when he checked into rehab. And we were 30 at the time. And looking back, he probably had his first episode as a teenager. So the first question I got really interested in is, why are we so bad at detecting these illnesses, even when they're actually quite severe? Like he'd had quite severe issues by that point. And so I got really interested in mental health measurement and started a project at Google X that was around using biomarkers as well, brain-based biomarkers, as well as wearable data to better measure mental health. And the idea was we would deploy this in places like primary care, so you could do a mental health test as a screening test as part of your annual physical. But I'm a product person at heart. So we did a ton of user interviews. We talked to young people, we talked to social workers, we talked to therapists, we talked to doctors. And everyone kept saying the same thing over and over again, that measurement is a somewhat unsolved problem in mental health, but the bigger issue is that we don't have enough mental health professionals. There's about 600 therapists in this country, and there's over 70 million people with a diagnosis. So as a result, only about half get any care at all. And one of those people was Kim, who was a pediatrician who saw a lot of mental health patients in her primary care practice and said, look, I know they need help. I can't get them into therapy. And so as a technologist, of course, I thought maybe there's a technical solution, but I realized very quickly we can't solve this with apps. We actually need humans in the loop. But does that human always need to be a master's level therapist? And so I came back to peer support, which is something I had experienced personally when my husband did a 12-step program and I did family groups, and looked at the evidence, which is incredibly powerful, and said, okay, here is a way that we can start closing this care gap by just training a lot more people to become entry-level mental health professionals.
That's really fantastic. And thank you so much for sharing about your lived experience. And Brandon, also the same too. I know we're going to be addressing that later on in this conversation. But on the flip side, Kim, I would love to kind of hear from you as a pediatrician, how does Peers.net complement existing clinical support, right? Leveraging the human and the tech piece.
That's right, Yuki. Thanks for that question. I often joke that I'm a pediatrician by training and a mental health expert by the seat of my pants. because mental health care in our country is often delivered by primary care providers who don't have enough time or expertise to deliver care, the best type of care that people need. And mental health care delivery is not ideal in many ways. It's siloed. There aren't enough licensed clinicians. The wait is long, and there's no support between visits when people live and experience their mental health conditions. So what peer support is, in my mind, it's evidence-based mental health support. So great evidence that it works by people centering their lived experience. So people who've lived in your shoes. And it really is effective across the whole acuity spectrum. So often peer support can sit in the preclinical space, sort of someone's had an acute stress, a breakup, some trauma, and really be the only or the primary support. It's like extending that village that we all used to have. And as our societies become fractured, we don't have so much anymore. But peer support is also an adjunct to help people live and cope with their condition as they're getting other mental health supports. Evidence shows it really increases engagement in other mental health supports, and it really decreases the use of higher levels of care, like emergency rooms, hospitals that not only are expensive, but they themselves can be traumatizing in the course of a mental health episode. So really, in our mind, centering lived experience is a force multiplier in the entire care system.
Yeah, and I think that makes a lot of sense. And on top of that, right, it's accessible. You're hopefully, talking to peers that come from a similar background, demographic, economic sort of backgrounds. So I think that makes a lot of sense. Tracy, from that sort of crisis intervention standpoint, what did you see sort of missing in the current ecosystem, and how does Vita Health fill that gap?
Thanks also for having us. It's such an honor and a privilege to be with this really esteemed group, yourself included, Yuki. And there's so much alignment across all of us, and you'll probably hear that. Maybe I'll start with good news in that, particularly since the pandemic, I feel that there's a greater awareness across the ecosystem of the rising mental health crisis and the need for innovation solutions and new partners to help us, bring solutions forward to help patients and to help people who are struggling. I also think, particularly, I know all of us focus on youth and young adults. I think we've seen some decrease in stigma in going out and getting care and seeking care. So those are two really good things that I would start with. But what Kim and Obi share is really relevant, in which we have problems with then meeting people where they're at. The system is overwhelmed. There's not enough clinicians to serve and to care for people who need help at critical times. And we know when people, although since the pandemic, there's been many, many companies that have begun to deliver care virtually, which has been a great innovation, being able to help people, stay in their home or in their school, at work, and engage in therapy. We know that there are increasing rates of acute mental health crises. 36% increase in suicide rates over the last 20 years. For youth and young adults, that's closer to 50%. And within some groups within young adults, even higher than that. So we know that the mental health crisis and lack of access to care is leading to higher rates of suicide across our country, but in particular in young adults. And the system is not prepared. And as Kim shared, folks are often sent to higher levels of care, emergency rooms, inpatient centers, where those centers are really not equipped to help care for people and help serve the underlying need, particularly with suicide. And so that's where Vita Health comes in. We've developed a virtual therapy-based intervention to serve this acute population, people who are struggling and who are now finding themselves in crisis. And we're excited to share more about that in the course of this conversation.
So I think what's actually unique about our two companies is that we're not afraid of taking teens and young adults who are suicidal. Vita, you built the entire company around this premise, but because we have an ethos of peer support that we want to support everyone who comes to our doorstep, we realize we have to also support people who endorse question 9 on PHQ-9. But that's not the case with a lot of digital health solutions. So many therapists won't take a youth that's been in the emergency room with a suicide attempt, and many digital health platforms screen out for that. And so that, I think, makes the need even more acute, that people who have been in those sort of more distressing situations then have even fewer options to go to. And that's why we wanted to tackle that.
Yeah, and that actually takes me to my next question, right? How do you balance the risks and benefits, especially when you're working with such vulnerable populations? Kim, maybe I can start with you.
Well, risks and benefits of technology in general is like the $10,000 question. So, just leaning into how does tech help and hurt our young people? There's so much good, from the fact that my own 14-year-old who struggles with a pretty significant mental health condition has not only used it to research their own mental health condition and has gotten a lot of insight from it. She's found community in their special interests and kind of people who get them, and is a place where they get therapeutic support. On the other hand, there really is some ugliness. And what we know is that the algorithms that are part of the internet and social media pull kids rapidly into very unhealthy places, from pornography, which the unbelievable exposure of very violent and not normal pornography in our young people causes deep trauma that's going to impact their ability to be intimate for a long time. We have abilities to exponentially increase our opportunity to compare ourselves to other people, which is very harmful to mental health. We have needs to have, be, buy, experience things because we're seeing what other people are doing all the time. So, and screens take us away from some of the things we know are protective of our mental health, which are being in physical community with people. So when we built our platform, it's super important to really acknowledge the risks and the strengths of technology and to make sure that we create a place that's safe, secure, private, that we have excellent quality and risk management standards, and that we know that the care that we're delivering, we look at every way possible to make sure that the care that we're delivering, the communication, the community, the experiences young people are having are really in an environment of safety and security and high quality.
Yeah, no, thank you for that. I mean, it's definitely a dual nature. I know we've talked about this on other sort of conversations in this series of sort of the benefits and the risks and the benefits, especially for youth. And technology is everything from the screens, social media to other platforms. Tracy, how do you and how has your team thought through the benefits and risks?
Absolutely, and I agree with Kim on so many of the risks, and they're serious and real, and we need to think collectively about how to protect our youth and young adults. However, I think the way we're thinking about technology here at Vita Health is how do we harness it as a tool for treatment and for care? And so that's where a virtual telehealth setting comes in. We also know that for many youth and young adults, they're not picking up the phone and asking for help. So utilizing technology, chat rooms, texts, those kind of things are much easier ways to quickly gain access to care, and very important. We know, and as a mom myself of 20-something daughters, social connection is largely through media now and through technology. Friends across the world, which is a beautiful, wonderful thing. And so how do we harness technology to connect young adults to each other and help each other? I also just would say that, this generation is much more agile and so much more adept at quickly finding out what resources are available to them. And that's a wonderful, wonderful thing. And so I think we start from a very similar premise of how do we empower the youth and young adults that we serve to get connected to care, to get connected to others, and to be empowered with some self-management tools, in addition to therapeutic interventions. And that's really critical to us. So while at Vita Health, we are delivering a 12-session therapy-based intervention specific to suicide. We partner with our patients, and we try to customize very closely and teach them some self-management skills, and then give them a companion app that helps them to record all of the skills and tools and lessons that they've learned in therapy. They keep that in their pocket, in their phone, for in between sessions, and even when care has been concluded. Those are some ways that we think about leveraging technology.
Yeah, no, thank you. And I think the big thing is keep hearing is sort of the empowerment, like how, right, it's not taking it away completely, but how do we provide them with the tools necessary to be able to navigate technology? And, it's about finding the right balance. So, one major challenge in making sure that these solutions, it's not just about in theory that they work in theory, but they also reach the young people that need it the most. So that kind of brings us to the next topic around accessibility and inclusion. So technology often, I think, struggles to reach marginalized youth. So how do sort of each of you guys think about ensuring that your solutions are truly accessible and equitable? Starting with you, Kim, there's so many digital health interventions out there that fail to reach marginalized youth. How do you think about deploying these technology-based solutions to maximize impact?
Yeah. Such an important question. And really, the way we think about it is to first involve marginalized youth in the process of design from the very start, to give them a voice. So we knew from the beginning that we wanted to reach marginalized youth, that we wanted to reach out to Medicaid populations, to young people who get governmental healthcare support. And we knew that if we built a solution and the only voices we talked to were people from affluent places, that the solution would not work for young people who are very system infected. Those young people often really mistrust the systems that they've been a part of for a long time. So co-design from the start with the young people that we really wanted to meet was really important. And recruiting and training the peer supporters on our platform, from the very beginning, we have been so lucky to have an incredible pipeline of young people who come from a huge variety of communities. So a lot of young people in our country are marginalized by things like time and place. So that's a way that digital can bring support to people who are in rural areas, who may be at school and at work and just don't have time to get across town, or don't have transportation, and their caregivers don't either. So bringing digital is a way to bring support to a time and a place where more vulnerable and marginalized youth can get it. And then the identity piece is so key. And we heard that from the very beginning. People want care delivery by people not who look like me, which is really the face of many of our licensed healthcare providers, mental health providers across this country, but by people who look like them, by people who get them, who've shared the same backgrounds, whether it's being brown or Black, LGBTQ+, et cetera. And as I said, there's so much distrust. So we really have believed that through our co-design, we try to build signals and processes that become trustworthy, and ways that people can put their toe in. We have a vibe check, for example, where people don't know, do I really want to book a video visit? Well, let's test it out with a little texting or chat. Our look and feel is really important. Our social media presence has to reflect the young people that we want to serve. And so those are some of the ways that we have thought about it from the very start.
Yeah, no, thank you so much. And you brought up a really good point around co-design, co-development. I know, I think all of the products we're talking about here has done some level of co-development. I know Peers.net in particular has done quite a bit. Obi, from sort of that product standpoint, what have you learned from young people in the process of developing Peers.net?
Right. So I come from the tech industry, where co-designing with your users is much more common. I'm still actually astonished how little happens in healthcare in general, and even specifically in mental health. So I right from the beginning, we started, and it can be very simple things like focus groups, surveys, user experience sessions where you show them a prototype, you get their feedback. We launched our website in a very, very beta form. In fact, I remember, Brandon, it was the first week of the accelerator, and we were pushing the website live. And I was almost embarrassed. It was good, solid, but it wasn't what we wanted. But I am very much of the opinion it's much better to get something out there as long as it's safe, and then learn from your users, even if the feedback isn't super favorable. So we iterated to the website that you see today over all the months of getting feedback from youth. And then last year, we did a program called Headstream, It's an accelerator that co-creates specifically with BIPOC and LGBTQ plus youth. And they were very vocal, in our co-design sessions about like what they were looking for and so on. And perhaps the biggest surprise that came out of that one for me was quite how much they don't want traditional telehealth. Like that booking a video visit, even if it's the next day, which for all of us who live our life in Zoom or Google Meet is completely normal, right, was a big hurdle for them. They were like, I'm not sure I want to be on camera, especially if you have body issues. I'm not sure I want to commit to talking to someone for 50 minutes. So it wasn't how they live their life. They live their life in chat-based environments, messaging apps, and talking to their friends. And they live their life consuming video. And so we're basically imposing a healthcare system on them that doesn't really resonate. And so we started looking much more into like, how can we do chat-based mental health care, for example, not just in between sessions, but potentially even like in conducting the entire session that way. Now, that does not fit well into a fee-for-service reimbursement model. So we then had to work with our health plan partners, like, okay, maybe if we do something like a monthly case rate, where we do have, 1 or 2 video visits, but the rest of the care can be delivered in a more flexible way as and when youth want it. And so I think that's really important. Like, we are sort of trying to balance these different constituents. We like, I always think of the triangle, like there's our peer supporters who really matter to us and making sure that they're supported and can do their best work. There's obviously the clients. And then there's also the people who pay for it, which in our case is the health plans. But making sure the youth voice doesn't get lost in that. Like sometimes it feels like we design the other way around, where we design for payers and for providers, and the patient has like the least voice in this. And for us, we really started at that part of the triangle. We started with the clients.
Yeah, no, that's really amazing. And it reminds me, I think, Kim, you mentioned, right, building the technology. Most people build technology to meet people where they're at. But then if you're not actually then building it for the people that you're trying to serve, then you just build technology just for it to kind of be there. So
and youth are ruthless. They just don't use it, right? Like you got like a few minutes to prove yourself, and then they're like, this is not for me. Next.
Yeah, I mean, technology is ubiquitous; it's everywhere, and so if you can't get that, catch your attention immediately, that makes a lot of sense. So Brandon, on that note, One Mind, especially I know yourself, emphasized lived experience in mental health solutions. So how does One Mind ensure that, in terms of investment priorities, you're prioritizing companies that look at lived experience and add that into their product experience?
Yeah, thanks for the question. I haven't shared explicitly on this call yet about my lived experience, but I'll start with that. And then as the springboard for why I believe it's so important to involve lived experience in guiding and leading mental health programs and services, and then how we do that through One Mind. So I was diagnosed with schizophrenia when I was 18 years old, so quite a while ago. And it was the scariest and the darkest experience of my life. I feel very grateful to be alive today after weathering about a few years of terrifying delusions and depression and anxiety that came from that, and the suicidality that stemmed from that, the exhaustion and the despair that grew out of that. 3 factors saw me through: my family's loving support, getting care early, like Pierce.net and Vita Health are offering to young people right now, and stay involved with the community to rebuild a sense of agency and purpose. And that's something that peers can help with as well. So I believe that lived experience is essential to guide these programs, not only because it provides better outcomes and engagement for the programs that are being offered to young people and people of all ages, but also because it provides a better success rate for the businesses that are offering these services and products, with a greater engagement, with a more success of their treatments and services for people, that'll help them grow their businesses even better. So we have a One Mind Lived Experience Council, which I launched last year. We are professionals who have expertise in fields related to research and innovation, and also workforce, the 3 focuses of One Mind's major programs. And we also have deep lived experience with significant mental health challenges. And so our mission as a council is to build a world where the trust in the mental health system is restored. As Kim was alluding to earlier, there's unfortunately a growing distrust in medical institutions and mental health care. There's also a lot of discrimination, unfortunately, from providers in some cases, or bias by providers about the credibility of the people that they're treating. And so we aim to heal that rift in our society and our mental health system by bringing together those two ends of the spectrum. It's not an us and a them. It's all on us, and we want to promote that notion, that reality. So what we do is we are advising One Mind Accelerator entrepreneurs, as well as One Mind Rising Star scientists and One Mind business leaders for our One Mind at Work program on how to meet the needs and interests effectively of people who struggle with mental health challenges, as well as helping them integrate more lived experience into their work. So for example, last year's One Mind Accelerator cohort, we advised about a third of the companies who were in that cohort on how to improve their what they're offering to people in their community. So one example is Pangea Bio, which was a deep science company developing a new treatment for schizophrenia, a new drug. We helped them refine their clinical trial processes and how they intake people into the trials. Another company called Obi Health, which is doing full stack, innovative, comprehensive mental health care for severe mental illness, including young people. We help them refine their intake processes and patient engagement practices to be more compassionate and welcoming and supportive of the well-being of their members, they call them, who are in the treatment. So really proud of the impact we've had so far as a council. Also, we've advised government agencies on how to incorporate lived experience into their work, such as ARPA-H. And so we are excited about the potential to grow this movement, which is, in fact, being demonstrated by the two companies we are talking with today, and many others in the space through the guidance of the One Mind Lived Experience Council.
Yeah, no, thank you so much. Yeah, and we're in this mental health crisis, youth mental health crisis, in particular, and we have to all sort of work together. There's this whole sort of continuum of care, and that's one thing I've seen, I think personally, from all these different organizations is how do we partner? How do we, tackle, our bits and pieces to be able to address all the different types of experiences. And you mentioned too, Brandon, a really important piece, which is that early detection and intervention piece. And I think it's so important, especially when it comes to crisis prevention. So kind of switching gears a little bit, Tracy, I would love to hear sort of, as Vita Health specializes in suicide prevention, so from your experience, what has been some of the most promising ways technology can be leveraged for early intervention and crisis prevention?
Yeah, absolutely. And would just sort of comment on what Brandon shared and your comments as well. This is all about layering options and levels of care. And so, when a person finds themselves sort of at this peak critical time where they're considering taking their life, we have a very strong opinion that it's technology plus human. A well-trained therapist who, to Obi's point, reflects and looks like the person that they're caring for, is representative of the communities that they're serving, along with an evidence-based protocol. For us, it's a BCBT-based, therapy intervention. That's critical to us. What we know for youth is their first experiences reaching out for care may determine whether or not they ever seek care again in their future. So it needs to be done well, thoughtfully, empathically, and in partnership. Old models of us being the expert no longer fit. And so really the person where we have the privilege and honor of working with is the expert on their life. And we partner with them alongside our intervention to deliver care in a way that is meaningful to them, that helps them to achieve their goals and helps them to find success again. I think Obi also talked about the importance, and so did Brandon, about community. And that's a big piece of what we do as well. We feel that offering our intervention virtually, it is an outpatient level of care for an acute need, keeps people in their communities. So we have colleges that we partner with who students would otherwise have to drop out of their semester potentially and get care in a higher level of care, get behind, feel some stigma about returning to school. they don't have to do that with Vita Health. So they can stay in their programs, stay as part of their community, and continue to receive care with us. We think that's really, really critically important. Another program that we have works with youth, mostly from the Medicaid system in New York, who are coming out of a hospitalization. So maybe for some reason we weren't able to get introduced to them early enough, but when they're stepping down back into their communities again, we provide a wraparound service, essentially, that where we meet with the youth, talk about what's most important to them, and the youth actually nominates a group of caring adults in their life that we then train and we spend time with over several months, equipping them to be a source of support for this youth to try to prevent a future hospitalization as well. So those are some ways that we leverage both technology and humans together to care for folks needing us.
Thank you. And it's such important work. And what I think love about it is right, it's almost it's not specifically like individualized, but it's personalized. And really that's so important. Like not one sort of solution fits for each individual based on their situation. So that's really fantastic. Obi, how does peers.net think about the technology to help reduce unnecessary emergency room visits and hospitalization to improve outcomes for youth, especially when it comes to the mental health of these kids?
Yeah, I do some work still with a hospital in the UK, and their goal is to get youth out of the emergency room, because a London hospital on a Saturday night is not a great place for a teenager with self-harm or suicidal thought. I mean, probably never, right? And the emergency room staff also find it really hard to deal with that because they're not necessarily equipped with it. These are busy places and so on. And so in many cases, they just have to send them away again. And I got really interested in this sort of follow-up question of like, what happens when someone has called a crisis line, they've been stabilized, or they've been to the emergency room and they've been stabilized, and then they get sent away again, right? So this concept of like, can we give that follow-up in a very timely fashion is really important, and it shows that it leads to better outcomes, but that's not what's happening today. So about a third of youth who go to the emergency room today in the US don't get a follow-up appointment within 7 days, which is the HEDIS target. And then about a third end up back in the emergency room within 6 months. And so that's not good for the youth. It's not great for the parent, who might be taking them. It costs the system money because they're not getting any treatment. It costs, at least $500 per emergency room visit. And we can provide 2 months of peer support for that in that sort of follow-up to help people figure out, like, what is the kind of care they need, help them navigate the system. If they do need more than peer support, help them get there. So that's one way I think about it, is like that we could use it to just be kind of the very instant access intervention that then helps people navigate to the right level of care. But then there's also a question of maintenance care. So if you have serious mental illness, you are living with that in most cases for the rest of your life, right? And in psychiatry, there's a concept that you start on a high level of drugs and then you sort of reduce it down to a maintenance dose. But there's no equivalent on the talk therapy side. Therapy is actually a pretty intensive intervention where you meet with someone once a week for an hour, and it's it's pretty expensive. It's also pretty intense. And people are like, but I'm better. I don't want to meet with my therapist anymore. But then they go to nothing. And nothing's not enough either. So I think of peer support as that sort of layer of maintenance care where you can like tune in and out. Maybe you meet with someone once a month, just as a check-in. Are you still doing okay? And then if you are sort of finding yourself like falling off, sliding down into like another episode, there's someone who can catch you and can help you like re-engage with care. And, I live with that with my husband, so I can see it, like how hard it is. Like if you've been discharged because you're better, right? You're out of the care system, and then re-entering it can be actually really difficult and traumatic. So that I think is also another way that we can avoid these unnecessary crises, so that we can basically catch people on the way down before they hit the bottom again.
Yeah, I mean, you bring up a really good point too, in terms of like, right, any other sort of health illness concern where there's medication involved, there's usually a process. There's like hard numbers that you work with, in terms of like a step down. And in the youth mental health space, especially around talk therapy, there's just no standardization. There's nothing really there. So it's fantastic that we have organizations like Peers.net and like Vita Health that are providing that necessary support. And talking about sort of crisis prevention, especially, the technology's potential to intervene early, it does raise an important question about how we use data responsibly. So being intentional about data collection, I know, is a key ethical consideration with mental health tech. So Obi, just from a product perspective and from Peers.net, I know you intentionally built it to be web-based. And to not collect, like mobile phone data and things like that. Why was that a really important design choice for you guys?
So that actually came from once we honed in on the population that we want to serve, right? Which includes teenagers, including teenagers on Medicaid who might not have their own device, right? Or might not have a device where they're allowed to install apps on. So people sort of forget about that, right? Like if we just design for the people in our surrounding where, every kid has an iPhone and they can do whatever they want with it, even though Kim has strong opinions about why that might not be a good idea either, right? That's not the reality of most youth, right? They might have access to a Chromebook via their school. They might be borrowing someone's phone. So for us, it's really, we decided very quickly that we weren't going to build an app and that we would just make the entire service work in the browser. That means we do collect less information. It means we can't send them sort of, notifications to remind them things. We had to fall back, for instance, on text messages to remind them about hey, your appointment is coming up and so on. But I very much believe you have to start with what's the user's need, and then you design the technology around it. Now, I mentioned that the project I did before I started Peers.net, it was all around measurement. So there we did collect a lot of mobile data, and you can derive someone's mental health state based on a whole load of passive markers. So it's usually not just one. So it's not like you can get it all from how people use their keyboard or their location. But when you take a number of them together, like your sleep patterns, your activity patterns, whether you haven't left your home in a few days, that's a really good flag. Whether you've woken up later and later, that's a flag for depression. Whether you're waking up in the middle of the night ruminating, that's a flag for anxiety. But you have to do that with the person's consent. So I think that's very tricky if you're doing that in a care app. If you're doing that in a separate measurement app, then it's very clear, right? The person's like, I wear an Oura Ring because I want them to track my sleep, and then I get access to that data. So there's a big kind of clear ethical boundary of what data they collect and how they use it. But in mental health, I feel like we have to be incredibly thoughtful if we were to collect those data. We do record our sessions for quality and safety purposes. It serves many different purposes, including being able to give feedback to our peer supporters and being able to detect risks. So for instance, if someone's talking about suicide, but even there, we want to make sure that the youth has the option to opt out, and some do.
Yeah, and right to the whole point of kind of empowerment and control over what is being shared. That makes perfect sense. And then Tracy, I know Vita Health also does not collect passive mobile app data. So how does that shape your clinical approach, and what sort of ethical considerations, especially given the space that you're in, did you have to sort of navigate?
Yeah. So first, I would say, for us, we see our app as a toolkit. A resource, a reinforcement of skills, videos, lessons, a place where work that has been done in therapy can be stored. It certainly is not required for someone who is seeking care. So if someone does not have access to a smartphone, they can get the same high quality care, and we can deliver some of those resources in old-fashioned methodologies. So we really see, and what our patients tell us is, it's very helpful to sort of have immediate access to their safety plan that they have developed with their therapist. And the safety plan includes things like being able to recognize what my warning signs are, being able to try some self-regulation activities, being able to reach out to my community and who in my community are those safe people. Having that stored in one location is really, really important, along with what are my reasons for living. And so there's modules within our app that help to sort of store things that have been discussed and could be also written down on paper if need be. And so we see it as a tool, and we use it in that way with our patients, and our patients maintain access to that beyond concluding care with us. And so it's something they can actually update, they can personalize over the course of their life, actually.
Oh, yeah, so definitely. It sounds similar to sort of how Obi and Kim have thought about the data that's being collected, if any, and then how that's being used and, is in the patient or the participant's sort of hand.
Yes.
So looking ahead, the field of mental health technology, is evolving so rapidly. And so as we wrap up, I would love to kind of take a moment to be able to talk about the future and what's one key takeaway you want the audience to leave with. So Brandon, I will start with you.
Thank you. So really excited for the potential of companies like Peers.net and Vita Health to help the mental health of young people. There's some things to look out for as technology evolves, and we need to get ahead of them. So for example, generative AI. So many young people have turned historically to, over the past few years, to things like social media to get the first line of information about what they're experiencing with their mental health challenges, if they are. Now generative AI is becoming a tool that more young people are turning to, just even basic apps like ChatGPT, to ask questions about mental health issues that they're experiencing or their friends are experiencing. And this is a double-edged sword. So basically, the fact that generative AI is available at any time to anyone, anywhere, can enable, kind of along the lines of what Tracy was saying earlier, easy access to something that could be supportive, at least basic by-the-book advice that comes from some reputable sources, or some, as well as some that are not necessarily reputable, in the basic data that is the generative AI is based on. So although it can give a greater sense of access and a greater reach of mental health information, unfortunately, it doesn't have human experience to back up the recommendations that it gives, which is an essential component of mental health therapy and counseling. It can unfortunately direct young people into rabbit holes of the wrong way to address mental health situations. And so we need to get out ahead of this. And so basically, there are some companies in One Mind Accelerator's 2025 cohort, which will announce who they are very soon, that are addressing this in innovative ways. For example, using generative AI as an adjunct to human support, kind of along the lines of what Kim and Tracy were describing, in terms of the technology being an adjunct to the therapist, providing the actual counseling and therapy. So looking forward to seeing what these companies do with their technology and how they weave in human support, using the generative AI as a kind of after hours or supportive tool, adjunctive tool for helping the young people when they can't talk to their therapist, and need additional sense of comfort and security.
No, thank you. And I look forward to seeing the next cohort from the Accelerator program. And, obviously Gen AI is very much in the current events, a lot of discussions around that. So excited to see what comes out of that. Obi, what are some of your final parting thoughts?
So I'm going to talk about AI too. I mean, I've worked in AI for over 15 years, so I'm probably a dinosaur in this field. And when we first started the company, we were thinking of using AI more on the back end. So how do we support our peer supporters? How do we, do safety and things like that by what we can derive from, for example, session recordings. But then I saw the same trend that Brandon's seeing, is that teenagers are actually using Gen AI. And I would say it's not even ChatGPT. Yes, they use that maybe to ask it a few questions. They mostly use that for homework help. What they're really using is character AI. And character AI is a whole new paradigm where you're interacting with a character, and it can be interesting and fun and beneficial, but it can also have a dark side, which is you can get sucked into interacting with this artificial human that actually takes you away from spending time with real humans. So I think that's like the next frontier, that most parents are still thinking social media. You know, Jonathan Haidt's book was all about social media, and no one talks about this. But when you talk to teens and you're like, hey, have you used character AI? Almost all of them will say yes. And they really love it because it's way more engaging than old style chatbots. And so I'm really excited also about like this vision of having, can we have a hybrid care model where we can leverage the skills of the human peer supports, but also LLM agents that are built on this sort of cutting edge technology. So I don't want to build a standalone AI agent that can replace the human. It's really, how do you blend the two? So the agent can do things in the middle of the night, for example. If I'm waking up with a panic attack and I, want to talk to someone, like the person, like your human's probably not available because they're asleep, right? So if it's based on evidence-based practices and incorporates evidence-based interactions, it can absolutely say, hey, here's like some exercises and some tools you could do right away now. I think it has to be, again, designed with youth, right? Understanding Gen Z's, the way they talk, slang, emojis, humor, right? They use that in a very different way. Like even millennials don't get it, and definitely like Gen Xers like us don't get it. So you can't just build like a generalist AI and expect it to work. And in fact, like you look at Wobot is a really wonderful first generation chatbot, but it doesn't get ADHD. So I want to replicate that same sort of personalization that people get when they pick their peer supporter and they say, I am talking to someone who's been in my shoes with the agent. So, and then the final piece is like, it's non-obvious how you blend human care and AI care, right? So is it that it's just available between sessions? Does it have context from both like agent delivered and human delivered sessions? And when does it detect when there's over attachment, right? Like when the youth just wants to spend all the time talking to the AI because that's easier than talking to their real friends or talking to their mom, right? And gently redirecting them back to humans, whether that's one of our peer supporters who actually has real life experience as opposed to simulated life experience, or whether it's actually directing them back to friends and family and other important people in their lives. And for that, we really like to kind of hit these points, like safety, building it with and for youth and so on. We have to build them bespoke. We can't just rely on the generalist agents that are out there today.
Yeah, I 100%, I completely agree. And I feel like this is a whole nother conversation topic that needs to kind of come off of this on Gen AI. And so Tracy, with you, sort of what are some of your parting thoughts, especially around sort of the crisis detection and intervention that most excite you?
I think the opportunity and ability to innovate the current system of care that we kind of started this conversation with, sort of the gaps in care that, for people with acute mental health needs, I'm most excited. And that would be impossible without creative partnerships like One Mind and like other venture partners that have invested in Vita Health. So people taking risk and saying, we must do better. We can do better. We're going to put dollars behind this. This is essential. It's essential for us to iterate on our companies and get better over time. And it requires these creative partnerships. I think there's other opportunities to serve other acute conditions. We often find sort of a correlation with suicide, a lot of trauma. And I think also a lot of people with severe trauma end up in some of the same higher level of settings that we talked about before. And so it's part of our strategic plan is to continue to grow virtual interventions. A study just came out of Ohio University that telebehavioral health, BCBT, which is the protocol we use, is just as effective and is in a telehealth setting. And that's really important research for us to sort of, shout from the rooftops that any biases that we may have about in-person care are being disproven with research. And so we're doing good work. We need continued investment, and there's more work to do in our future around acute mental health needs.
Thank you so much, Tracy and Kim. So wrapping it up, how do you see, right, as a pediatrician, how do you see these digital mental health tech integrating into the clinical care, moving into the future? I believe you're on mute.
Thanks for that question. And just like Obi said that she's a dinosaur, I am too, because I've been asking that question for many years, starting when I was working within Kaiser Permanente and trying to figure out how do we use these really great, exciting digital tools that have so much potential, but how do we make sure that they are really focusing on the right outcomes? That's what we care about is the patient, right? And they're usable by the doctors, the other clinicians in the healthcare system and in the system themselves, and they have a payment model. So it's super complex. But what I'll say that what I fight for is using digital tools and virtual environments alongside traditional clinical work to augment human-centered care. And it's really bridging gaps in connection that the traditional system doesn't allow. So I always ask myself, how can we bring that magic that's true human connection and understanding? That's happened between healers and their patients since ancient times.
Yes.
So how can we use technology to bring that to young people and all patients where they are, when they need it, by people they can trust?
Yeah, no, thank you so much. And yeah, as you said, just bridging that gap. And I like the word use of magic in that. So this has been such an incredible, insightful conversation. So thank you so much to all four of you guys for sharing your expertise and being part of this experience. We did cover a lot today, everything from how funding decisions shape mental health innovation to the importance of co-developing solutions, co-designing solutions with youth. We've heard about how peers.net is expanding peer support and how Vita Health is addressing, the crisis care gaps, and how One Mind is really driving investments in early interventions and real world impact. And I think we've also tackled a lot of really tough questions, everything from balancing the risks and benefits of technology, ensuring accessibility, or how to think about accessibility, especially for marginalized youth, and how to make sort of ethical design choices and decisions that prioritize the trust and safety, especially when it comes to youth mental health. So it's very clear, I think, for this conversation that technology has and actually is having potential impact to transform youth mental health care. But the key, I think, the takeaway that I'm taking away from all four of you is how we thoughtfully and responsibly think about truly meeting the needs of young people today. So thank you guys for joining this conversation. Really appreciate your time. Thank you.
Thank you.
Thank you.
Thanks for having us.